Welcome back. This week in this lecture, we will focus on learning different assessment systems for young children. So these are the objectives. Today, we'll mostly talk about appropriate methods of assessing infant and young children. Last week, we learned about the importance of using multiple sources of information. Of course, multiple sources are better than a single observation. So, using multiple standardized tests, for example, if you can get information about child's development from parents' view, and also if you can figure out the student's interests and learning style, it would be great, right? Also, you should observe the student's behavior in different settings and conditions across school settings or other settings such as home setting. Assessment should benefit the child and improve the child's learning. Sometimes tests are administered to young children to determine whether they can be admitted to a preschool program or promoted in grade. So the results sometimes make the students more isolated and result in placing the students segregated classrooms. I'm not saying that segregated classroom is not beneficial, but if the assessment results in separating them from mainstreaming, that is not good, right? So the assessment should benefit child by determining the student's progress and planning appropriate instruction based on the assessment result. Family is really important across a child's educational services and process. Family has an important role in assessment as well. Infant and other young children may not be able to understand their own developmental process, but parents and primary caregivers can provide important information, right? So to get the meaningful information about the young children from the family, you need to develop collaborative relationship with them. Assessment should be fair for all children. Yes, it should be fair for everyone. Like we said, students with CLD background, culturally and linguistically diverse background, it is not a fair process yet. We need more culturally and linguistically responsive assessment process and instruments as well. Chicago and other urban areas experience poverty issue. That means students may not get appropriate educational services, including this assessment service, due to the limited access to the appropriate resources. So there should be more attention given to those diverse population. Last week, we talked about why we assess the student to diagnose, place, and plan individualized program. There are various assessment formats available to meet those goals. First one is informal assessment. The most popular format of informal assessment is observation. Teachers just observe how their students are doing with, for example, worksheets or play materials, and they write down their observation in an objective way. Formal assessment is when standardized tests are used for the measurement and evaluation of students' development and progress. Last week we said the purpose of assessment vary by ages. Do you remember the main purpose of assessment of young children? We want to know if a young child's development is progressing normally. So right after a child's birth, a pediatrician or neonatologist evaluate the newborn using Apgar scale to determine if the baby is in good health. Let's watch a short video about Apgar assessment.
Today's topic is Apgar score. The Apgar score is an assessment of the physical condition of newborns in their first moment of life. This assessment helps health practitioners in their decision-making, so they could quickly tell if a newborn baby needed immediate medical care. An anesthesiologist at the New York Presbyterian Hospital, named Dr. Virginia Apgar, discovered the score in 1952 to assess the health and vital signs of a newborn baby. The test is given at 1 minute after birth and again at 5 minutes after birth. In cases where there are still some concerns about the baby's condition, the test may be given again. The score obtained at the 1-minute mark determines how well the baby tolerated the birthing process, and the 5-minute score tells of how the baby is doing outside the mother's womb. How does it work? The Apgar score is calculated by evaluating the baby on 5 criteria. Each criterion receives a score between 0, 1, or 2, depending on the observed condition. The values obtained from each is then summed up. The resulting Apgar score ranges from 0 to 10. The 5 criteria are appearance, pulse, grimace, activity, respiration. Appearance, or skin color. If the skin color appears blue, bluish-gray, or pale, the infant is scored 0 for color. If the body is pink, but the extremities, like the hands and feet, are blue, the infant is scored 1 for color. If the entire body appears normal and is pink, the infant scores 2 for color. Pulse, or heart rate. If there is no pulse, the infant scores 0 for pulse. If the pulse is less than 100 beats per minute, the infant is scored 1 for pulse. If the pulse is greater than 100 beats per minute, the infant is scored 2 for pulse. Grimace, or reflex response. How the baby responds to stimulation, like a mild pinch. If there is no response or reaction, the infant is scored 0 for grimace. If there is a facial movement only, the infant is scored 1 for grimace. If there is a cough, sneeze, cry, or pulling away, the infant is scored 2 for grimace. Activity, or muscle tone. If the muscles are loose and floppy, and no movement, the infant is scored 0 for activity. If the arms and legs are flexed with little movement, the infant is scored 1 for activity. If there is an active, spontaneous movement, the infant is scored 2 for activity. Respiration, or breathing. If there is an absence of respiration, the infant is scored 0 for respiration. If the respirations are slow and irregular, with weak cry, the infant is scored 1 for respiration. If the respiration is normal with a good, strong cry, the infant is scored 2 for respiration. What does the score mean? The first Apgar score gives the health practitioners a clue in deciding if the baby needs immediate medical attention. A score between 7 and 10 is good and means that your baby is in good shape. If the score is between 4 and 6, it means that the baby may need help with breathing, such as suctioning the airways, massaging, or giving him oxygen to help such baby breathe better. If the score is 3 or less, the baby may need immediate resuscitative measures. However, a slightly low score is common in babies born prematurely, with complicated deliveries, or through a C-section. The second score helps the health practitioner to know how well the baby is progressing and whether the baby has responded to any previous medical intervention. A score above 7 is considered normal. If the score is still low at this point, the baby may need medical help and will be monitored closely. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
So after the birth, many generic disorders or disability can be detected. For example, phenylketonuria, also known as PKU screening, can be done to detect the presence of the enzyme phenylalanine, which can cause intellectual disability throughout their lives. Premature babies, of course, are screened to protect the baby's health-related issues. So many generic disorders like Down syndrome or PKU related to intellectual disability. So if the child has those generic disorders, the child's intellectual ability is tested consistently as the child grows up. So with medical support, early intervention services are provided. There are many types of assessment systems to understand a child more comprehensively. These are the examples. The first one, developmental screening tools and standardized assessment. Well, there are tons of screeners and standardized test tool available for us, for teachers. So screening provides snapshots of a child's development across domains and tell us if further assessment is needed. If further assessment is needed, you need to consider to use standardized tests like diagnostic test. But usually medical diagnosis is made by certified psychologists or medical doctors. But there are some diagnostic tools available for teacher. The tools provide educational diagnosis. So we're going to talk about those tools and practice throughout the semester. Second one is anecdotal observation and journal. So you, teacher, will observe the student's daily routine and record. So for example, you're going to observe what the child play with, how long the child was engaged in certain behaviors. You can write a journal regularly, so you can share your journals with caregivers and get interactive feedback from family. Photo documentation. You can take a picture of group or individual activity or accomplishment and make poster and see the student's progress. Portfolio. Many of assessment material we use can be organized and documented into a portfolio to make a comprehensive record of the child development. The last one is developmental profile. Developmental profile collects data from multiple sources and helps describe a child's overall development and learning. This is kind of summary statement across developmental domain. This includes observation and journal, photo, and other developmental scales. So you're going to get some summary statement. So this is an example of developmental profile from your textbook. This one has picture, but I don't recommend you to have picture because of the confidentiality. So please do not use photo or picture visual thing. Yep. So you're going to have this summary statement across developmental domain, and you are going to develop this developmental profile for your student after you use multiple sources of assessment. So this is kind of summary data across developmental domain. Here's more strategies you can use in your classroom for preschool and primary graders. Standardized tests in classroom can include achievement tests, ability tests, and interest tests. This is formal assessment. We'll talk about this and practice this throughout the semester. Other informal assessment include observation, teacher design measure, like teacher can request concrete tasks to complete or provide oral questions to answer, like quiz. Checklist is a list of learning objectives for an area of learning and development at a particular age, grade level, and content area. Rating scale is a similar one, but it has scale or level. Portfolio usually include collection of student work, right? And nowadays we use a lot of technology, so we use like ePortfolio app, or we create web page to share student work with caregivers. Throughout the use of these multiple sources, you will get some result, which can be both formal and informal. As a teacher, you will use the result to plan individualized instruction or modified instruction for your students. But you don't have to do individualized instruction. the result will tell you if some student needs special instructions or not, right? Also, you will use a result to report progress. So the assessment result should provide comprehensive information about how the child has developed and what has been learned. And the assessment process includes the evaluation of the effectiveness of the teacher's instruction, activity, and materials used with children. The teacher can use assessment information to determine whether instructional strategies were successful for children to learn new concepts and skills or new approaches is needed. How do you evaluate your quality of instruction? You should see if your student has made sufficient progress with your instruction, right? So you can look back students' assessment data. Teachers and teachers' instructions are also evaluated, but also learning environment should be assessed. So there are many assessment tools available to evaluate the elements and quality of environments, including this ERS, third edition, which we will cover in week 11. Now, school-aged children. We'll talk about how a process of assessment for school-aged children proceeds from the beginning of the year. When you have a new group of students, you want to learn about each individual child and each individual child's current developmental level, right? So you will have observation, interview with caregivers, you can use checklists, so you can get some idea where your instruction can begin, right? You call this process pre-assessment because this initial evaluation occurs before planning curriculum based on individual needs. Students' assessment should be ongoing, meaning data should be collected continuously throughout the school year. So there are two formats, formatives, summative. Formative are the strategies the teacher uses to monitor a child's progress in mastery of information or skills during a series of learning activity. So it's ongoing. Summative is used at the end of a cycle of instructional experience to confirm mastery of information or skills. You can summarize the ongoing assessment result and compare the difference from beginning to the end of semester. Or you can use standardized tests before and after semester so you can compare the students' achievement or development with the same age norm group. Now we're going to watch a short video clip about formative assessment. It can give you idea about what is formative assessment.
What do we know about a theme? What is a theme, Kylie?
A theme is a message, so an author uses a theme to tell us the message sometimes.
Okay. And what do we have to have when we choose a theme for the book? Drew?
Evidence.
Evidence. Where do we find the evidence?
In the book.
When I'm planning, I try to think about what my kids' strengths are and what needs I may have seen the day before. For example, like yesterday, we worked a lesson on themes, and they had a really hard time connecting the themes to the evidence that they found in the book. Sometimes the evidence didn't go with what they were trying to say. So today, that was one of the things that I was looking for. Were they able to make those connections together when they were doing their work? Did the theme go with the evidence that they had provided?
Who's adding to that? What are you adding?
Even though they pushed them out the door.
Who's they?
During the guided reading lessons, I always try to hopefully get to every student and at least hear a snippet out loud that they read to me. And during that time, I am watching for decoding and what errors that they're making, and if there's common patterns that I'm seeing. I'm also watching for fluency issues. Are they reading? How are they reading? Are they paying attention to punctuation? Are they reading with expression, or are they monotone? I'm a firm believer that you assess kids in many, many ways. You know, there are your standard assessments test and standardized tests and those things that you have to do. But one of the things that I do with each one of my kids has an assessment notebook. And inside of those notebooks are just anecdotal notes that I have taken from August to now. And I do that through conversations that they are having with each other, things that I notice when they may be up as a group presenting, things that they do with me during conferencing time, during guided reading lessons. I write on labels and I take running records. We develop rubrics. There's just many different things that we use to assess kids. They're just little notebooks that I keep that I just put their labels in at the end of the day. And so for the next week, especially when I'm planning guided reading lessons, I can flip through those notebooks, and that helps me group kids based on areas that they still may need work on, but it also helps me identify where can I go next. Like this, for example, would be a running record that I took, and then things that I noted. This lesson was about nonfiction and the components of nonfiction, and was this child able to tell me the purpose of table of contents, and was he able to locate information from that?
Prior to your assessment begins, you should consider several professional ethics. First, you should keep students and families' confidentiality. Do not share their individual information without parental permission. Also, parents should know that you will conduct such kind of assessment and the purpose of the assessment. So you should inform parents that which kind of assessment tool you want to use, and then what are the purpose of assessment. When you conduct assessment, make sure you know the stuff. If there is 100 questions in one assessment tool, the rules and test materials may be different in each question. So you should study and practice thoroughly so you can use the assessment time efficiently. Also, the assessment should be conducted by teacher or professionals with whom the student feels comfortable and in familiar environment, so student can focus on the assessment. If your student shows signs of fatigue or bad physical condition that day, then it's ideal to find a different assessment date. For students with disability and students with CLD background, culturally and linguistically diverse background, there are some modified administration procedures listed in each standardized test manual. So you should be aware of the procedures when your student has such disability like visual impairments or hearing loss, or CLD background, culturally and linguistically diverse background. So now you can prepare for your comprehensive case study assignment. So I want to talk about several things before you proceed. First, eventually you will need to develop developmental profile, as you see the example on the right side, right? So you're going to develop that developmental profile and have a summary statement across developmental domain. But please do not use photos to keep our child's confidentiality, and please use the pseudonym. And then when you when you use a pseudonym for the first time, you can put asterisk, like you see in the example. Amy is very active and physically. You see the asterisk. You can put the asterisk for the first time use, so you indicate that that is the pseudonym. For next week, please read Chapter 4. We are going to talk about how standardized tests are used, designed, and selected. And we are going to practice our second screening tool called ASQ3. It's a very famous tool and very simple. So we are going to practice ASQ3 next week. I'll see you next week. Bye.